Okay, so I guess scarring tissue, tendinitis, muscle strain.
Easy, this has been the darkest time in my life ever.
Let's start with week 18, which was a week that has allowed me to recover mentally and physically as well. I have to admit that I poured my heart out during week 17, and I guess that helped to walk into week 18 with a different mindset and probably a little bit more tolerance to disappointment. And actually, I feel like one of the most important things that has happened this week is that I switched my mindset. Before, I used to be very, very concerned about the timelines and the goals. I would read my physical therapy guideline. I would see what the timeline that the surgeon gave me looked like. And when I didn't hit one of those milestones, it would be very hard on me. And I would get concerned. I would think that I'm having a setback. I feel like a lot of the things that we do in general as human beings are about the expectation. You definitely enjoy the day that you accomplish something, but the building up to it is also something that like keeps you alive, and that sometimes you even enjoy more than the actual occurrence. Thinking, for example, that I was gonna run after month 3 and not doing it was really hard on me. Thinking that I was gonna go back on the ice by the end of month 3 was something that I was very much looking forward, and when it didn't happen, it hit me. So as of now, I have decided that I am not gonna focus on the milestones anymore. I don't wanna know when something is supposed to happen, and I'm just gonna welcome whatever my body wants to give me. And I guess this worked somehow, because at the end of this week, spoiler alert, I ended up running on the treadmill, which was something that I have been waiting for so long. As I'm saying, month 3. It was great. But that, even with that, I don't want to switch my strategy. I think I prefer not to be worrying about the milestones anymore and just celebrating whatever comes my way. I'm still with pain in the hip. And this is something that I wanted to talk about because today I was in my Facebook group. That Facebook group definitely has saved my life so many times. And there was someone that talked about them being 3 months post-op and still feeling the pain that they had pre-surgery. And a lot of people responded there saying that they had the same thing happening. Some people said that month 3 and 4 were really, really painful, but after month 6, things got better. And I was like, oh my God, people are feeling the same thing that I am feeling. It looks like it's something that happens. You have no idea the value of hearing these things. When someone else is going through the same thing, and not just one person, but multiple people, it helps to probably distribute the burden, but also helps you understand that you're not the only one, and this might be part of the recovery. And that's exactly the reason why I'm doing these videos, because I want you to not feel like you're alone. There are some things that are hard and that will happen and that we are all dealing with. I cannot stress enough how helpful it is to go through this journey with other people that have walked this pathway before. So yeah, I'm still having pain way less than the week before, but every time that I take a step, I feel the pain. I was telling my physical therapist yesterday, actually, I was like, I don't know if the pain has reduced or if I am just getting used to it. And he said that it may be a little bit of a combination of both things, because if the pain was too bad, I couldn't get used to it. Probably the pain has decreased. At the same time, probably I'm just getting used to it, which I definitely don't want to, and I hope that things get better. It's just what it is right now. So given that my hip is a little bit tight, that I'm still in pain, we added a hip flexor stretch where I lay on my back on a bench, pull the leg that is not stretching up towards my chest, and the leg that is stretching gets kind of like stuck between the legs of the bench, and I feel a crazy stretch. It is really good. I highly recommend it. I do that twice per leg for 1 minute each set, once or twice a day. The other thing that has happened is, as last week, this week we have adapted my physical therapy routine to be a little bit more gentle on the hip the days that I am not doing physical therapy with my therapist, which means that I have gone back to basics, doing table exercises, windshield wipers, just some joint movement and things like that to allow the hip to rest and recover as well. I did feel some pain after doing my squats and single leg exercises, but it didn't stay. It went away later. The other thing that I did notice was that my left hip is still giving me a fight. I've felt a little bit of pain while driving after running. And I really hope that that's just part of this crazy status of my body. So I definitely don't even want to think about the consequences of that pain getting worse. And when I had finally made up my mind of not having any milestones or anything really to look forward to, my physical therapist said, next session we're running on the treadmill. And I was like, dude, please stop. Like, I don't want to know. If it happens, it happens. If it doesn't happen, I am okay with it. And he's like, say whatever you want, but we are running on the treadmill. And it actually happened. And it has been one of the best moments during this recovery. I have been waiting for this for so long. Again, it's not only the fact that the hip is hardy enough to support my running, it's all the baggage that comes with this past month where I have almost lost my mind. So running was so exciting. I am not a runner, but when you go through this surgery, you end up loving the bike, the elliptical, the running machine, whatever it is. You just learn to appreciate all these things. And running actually comes in handy every now and then. I have noticed throughout this time that I actually run more than I think I do, and not to exercise, but more in the sense of me being late and running to make it to a meeting, or I don't know, trying to cross the street when there is traffic and things like that I am not allowed to do right now. And I feel the difference, and I actually feel that I am lacking something. So the funny thing was that at the end of the physical therapy session, my PT had a very descriptive prescription of what I was gonna do between sessions. Because now it's the weekend, so I don't know, maybe he has the experience of people overdoing it after they run the first time. So he told me exactly what I am gonna do within those 4 days that I have off without seeing him. So yeah, this is the best way to close this week, but we'll see. We'll take things as they come. Today is a very special day because my physical therapist added to the program that we will run today for 8 minutes, which are broken down in 1 minute run, 1 minute walk. But we're doing it like we're doing it in real life. We're running! This is a slope, so the hip is also being put on test on the slope. It's probably over 90 degrees right now, and it's just 7 a.m. So it's really hot and humid. We're feeling it. We have 7 more of these to go. Yay! We're halfway there, people. We're doing this. And forgive the shakiness, but I am running. Last one, people. He's tired. I am also not very energetic anymore, but we can do it. Did it. Holy shit. Very excited. Okay, people, we did it. Holy cow. I don't want to try my sweat, that looks horrible. Just so you see that this is real. I'm very excited. It was very interesting because usually when I start running out of the blue, in general, my legs start giving me trouble, like my muscles just don't want to run and I get sore 10 seconds in. That didn't happen this time. Probably it was because I walked for 20 minutes before we ran, and I also did the squats and everything, but it was just really interesting. The hip did bother me when I was walking, especially in between the sets, so we'll see how I feel a little bit later today. Yay, we did it! Hello! Today is the day after I ran. It's been probably like 27 hours or something like that. And I went on a walk today in the woods. There were a couple of hills and everything was okay. The hip was in pain, but the normal pain that I've been dealing with for the couple weeks. But then I got in the car, and then when I got out, I had a horrible pain in my hip and a pain in my knee. I waited out, and 10 minutes later it went away. And then I sat down for breakfast, and I stood up, and I have pain since then. It's been like an hour and a half or something like that, and it hurts like crazy. Like it's so intense. It's like a stabbing pain that comes and goes when I do some movements. It's really tough. It's really, really tough. I guess the hip is not super happy. I hope the pain goes away. I'm gonna do my physical therapy exercises right now, and hopefully that helps. What's up? I'm editing the video of the week 14 and 15, and I'm so happy, and I don't freaking know where this got lost in translation. Like, I looked so incredibly happy a month ago. This week has been so dark that I even have lost track of the weeks. I had so much hope. I was so happy, and then everything went south. As of now, my physical therapy has, I guess, kind of gone down to the table exercises that I used to do week 3 or 4 after surgery. I've been in so much pain that there was a day that I was limping. My PT did move my joint a lot in our last session, and that I think eased a little bit the pain. Like I am feeling a little bit better, but the other hip is hurting right now. So I guess one gets better and the other one takes over, and yeah, it feels like I'm taking one step forward and 2 steps backwards. And I was so excited about all this progress, and now I feel like we've gone back to almost the beginning. Yeah. Yeah, progress is definitely not linear, and again, I'm very grateful that I have a medical team that takes things seriously. The pain that I had the day after I ran turned out to be very serious. I had been in pain for 5 days, and in the 5th day I couldn't even walk because of how horrible the pain was. So within that time, perfect timing, I had my 4-month, which was more of like a 4.5-month post-op appointment with a surgeon, where we were supposed to talk about return to sports. And I am clearly not ready to go back to sports. And the interesting thing was that when the doctor found out that I've been in pain for 3 weeks, plus these 5 days of excruciating pain, he got very concerned. So he ordered an MRI again to see what's going on in there. He has a couple of theories, but he didn't really want to give me an absolute answer until he gets the MRI, which I understand. So I just got my MRI, and we'll see what the results say. We'll see what it comes back with. It's really frustrating, I'm not gonna lie. This has taken a lot of my time and my mental health. I don't know, I feel like somehow I'm relieved knowing that it's not that I am weak, and every time that I do something, I get a pushback from the hip, and apparently something is happening in there. We don't know what it is, and it's disappointing. I don't want to come off as impatient or anything, but being in constant pain for an extended period of time definitely affects you a lot. And that's what I've been living through lately. It's been horrible. And I'm trying to keep a positive attitude, but sometimes it's just hard, and sometimes I just melt down and then get the pieces back together. So what I can say right now is that my support network is helping a lot. My friends, my family, everybody's checking in, and that has definitely helped. One day at a time. I hope we can get rid of this pain soon. Okay, let's see what we got here. Scarring along the iliofemoral ligament with a small focus on capsular dehiscence cranially. Granulation tissue, mid gluteus medium, strain and peritendinitis. Okay, so I guess scarring tissue, tendinitis, muscle strain. No wonder why I've been in so much pain. I'm getting the shot today, so I changed to these shorts. But before that, I want to make sure that this is what's gonna, get rid of the scar tissue. So we'll see how it goes. Yeah, this is the machine they're gonna use to, I guess, know where to put the injection. It's like an ultrasound type of thing. Here is the shot. So they did it right next to the incision, one of the incisions. So it's here. And I have this thing that is kind of like a reaction from the Band-Aid. That's how it looks. I got out of physical therapy a couple of hours ago, but I had forgotten to talk about what happened there. This is the first physical therapy after the cortisone shot. So let's start with the cortisone shot, actually. It was not nice. Definitely painful, but not as bad as I thought it was gonna be. They put some numbing medicine on the skin, and then with an ultrasound machine they found the right spot, and then she just put the needle in. It felt like a stick or a knife getting in there, and when she put the liquid, that kind of recreated the most intense pain that I've been having so far. But given that I've been having that kind of pain, this I guess the injection didn't feel as bad. Now let's talk about the concerns and the issues that I have with this injection. I have to admit that every time that anybody would talk about a cortisone injection, I would completely zone out because I thought that I was not gonna need it. I had chosen the surgical route to avoid the cortisone injections, because cortisone injections is something that people would do if they want to avoid the surgery. But of course, it's a different thing. You will have to get them more often, and you have to modify your life and whatever. But I thought that if I choose the surgical route, I didn't have to even worry about that, which turns out to be wrong. And the cortisone shot that I got today is the same cortisone shot that people get when they want to avoid the surgery. It's a shot that is supposed to reduce the inflammation and help with the pain. It kicks in 2 to 3 days after. Right now they put another thing that it's like a numbing medicine, so I'm supposed to be numb for 12 hours, which I'm not. Like after physical therapy, I'm actually in a lot of pain. But then I'm gonna go back to my normal pain, and then I'm gonna, I guess, feel better. Okay, so let's start with the fact that I originally thought the cortisone shot would help dissolve the scar tissue, because that's what at least plastic surgeons do with scars and stuff like that. That's not the case in this particular situation. The idea of the cortisone shot is to help reduce the inflammation and help with the pain so that we can move forward with the treatment. I have a couple of concerns and objections about that. And I guess the first one is the fact that we are not really treating the root cause or fixing the root cause, because the scar tissue is still gonna be there. However, what my PT explained, which was easier for me to digest, is the fact that now that my pain levels are controlled and my inflammation is gonna go down, he can be more aggressive with moving the joints, so we can start hoping to break down some of the scar tissue. So he said that the scar tissue takes a long time to go away. He didn't promise, and the surgeon's office didn't promise either, that it was gonna go away ever, but it could start going away. It could reduce, and that's the hope with the PT. So his idea is that since I'm gonna have less inflammation, we are gonna be able to do more of the exercises more aggressively to break down that tissue. Now, I guess the other thing that I'm a little bit not swallowing is the fact that, again, we are not getting rid of the root cause of my pain. What's gonna happen in a couple of months? The main strategy right now is to address the most pressing issue, even with a short-term relief. So I don't even know how to express this without confusing people, because I don't even understand it. So please take everything that I'm saying today with a grain of salt. It's really not meant to guide you at all. I'm just telling you what my experience is, and I'm telling you how confusing this can be. But the thing is that the idea is to tackle the pain, which is what's not allowing me to move forward in physical therapy and in my recovery in general, in order to be able to be more aggressive in the recovery. Because when I don't have pain or inflammation, I'm gonna feel better, so we're gonna be able to be more aggressive and just like pass that, and then we'll see what happens. And I'm like, what? I am very and so we get this immediate solution or support, and then what? You know, like, that's my main question, and everybody's like, well, cross that bridge when we get there. Because apparently when you tackle the most immediate issue, then in the long term everything goes well. Like, these people have been seeing tons and tons of patients, and this method is working. So it's just very weird to me to, I guess, understand how the whole thing goes. I just don't appreciate so much uncertainty, and I am the type of personality that prefers to know exactly what's going to happen. And I understand that I am not going to be able to exactly know what's going on, but at least I would like to, like, I don't know, have an idea of what would happen later on. And I want to say that I 100% trust my team, my medical team, surgeon, PAs, PTs, everybody. I trust them, and I trust their judgment, and I am doing whatever they say, because I feel like when you are in a situation like this, you do need to trust the people that are doing these things. And I think part of the recovery is also this mindset of believing that this is gonna heal you, and putting the best, positive, biggest good vibes to get through this. They say that most of the patients don't go back for another cortisone shot or anything else, so I'm just gonna keep my positive thoughts and hope for the best. I guess last thing that I want to tell you is about this diary of pain. Diary of pain that I'm supposed to fill out. I have to put my level of pain every X amount of minutes or hours for them to know how this is going and if it's getting any better. And as I said, it's been very, very painful the past couple of hours, so I am assuming they are gonna be a little bit concerned, but I'm hopeful that once I go to bed and rest, I'm gonna wake up feeling better. Although 12 hours later, the numbing medicine is supposed to go away and I'm supposed to go back to my normal pain, so we'll see. It's really just like one day at a time and going through the motions and hoping for the best. We're about to hit day 3 since the cortisone shot, and I think it's starting to kick in because I feel less pain than normal. Moving and doing my PT still hurts a little bit, but I'm feeling way better than normal for sure. Another thing was that my surgeon's team talked to the physical therapist, and he was saying that they have this new plan, which I guess means more strengthening and more movement. I guess they want to be more aggressive with the physical therapy, so we'll see what that looks like. I haven't bought Kleenex in probably over 6 years. I am really not sure when I bought them last. Even though I figure skate, and you would think that I would buy Kleenex more often, but I've never run out of them until I did this month. And I actually had like brand new packages to go through, and that's why I'm saying it's not like, oh, you haven't bought Kleenex in 6 years, so of course you need more. No, it's because this month I ran out of Kleenex because I've been crying so much. So this is my new package of Kleenex that hopefully is gonna last me another 6 years, because I don't want to go back to the dark place that I was before. I'm just saying this not to be dramatic, so I'm just trying to share my story so you don't feel like you are the only one going through something as hard as this. It's been a week since the shot, and this is how I'm gonna finish this 5-month post-op video. I am feeling okay. I feel like the pain is less frequent and less intense. as opposed to a couple of weeks ago. However, it hasn't gone away 100%. So the idea was that when I got the shot, the first 24 hours I was going to be a little bit numb. And as I already explained, that's not how it happened. And then the cortisone would kick in within 2 or 3 days. I honestly don't feel like there was a before and an after during that process. It's just probably that the pain gradually went down. I have been walking quite a bunch, so I also understand why my hip could be a little bit upset, because I've been doing kind of like 10K every day. So I understand that the hip could be a little bit upset because of that as well. I do have some pain here where the tendinitis is. So again, we have an explanation for that as well. We'll see how this goes and what comes with it. Right now, in terms of physical therapy, I'm only doing my table exercises. I decided that I wanted to take a little break because I was losing my mind, and everybody agreed that I just needed to disconnect myself from everything that was going on. So I am taking a little bit of a break, doing only table exercises with physical therapy. And then the plan is to come back to my normal 2 physical therapy sessions a week and keep moving forward, hopefully with a recovery. 5 months post-op have brought me a couple of takeaways that I would like to share with you. These are things that come from my own experience, so maybe they can be useful for you. If they are not, just forget about them. But I definitely wanted to share a couple of these things that were very, very important for me. The first one, there is nobody to blame for what's going on right now. Scar tissue is a risk in a surgery like mine, and we all probably have developed it. However, some bodies react differently to scar tissue than others. I am prone to scars. I have keloids and I have had thick scars, so I am not surprised that my body either produces more scar tissue or that it's not getting rid of the scar tissue as efficiently as other bodies could be. And I have learned from studying what's going on that there isn't really anybody to blame. And I don't want to blame anybody either, because I don't think that's going to be productive at all. It's not that I overdid it. It's not that the surgeon committed a mistake. It's not that my PT overdid it. It just happened. Shit happens sometimes. I guess I had a lucky number. And the most important thing here is to have a plan to move forward. And that connects me to what I've been talking about of the cortisone shot and how I want to know that we're not putting a Band-Aid on it and that we have a plan to move forward. The second thing is that it's okay to tolerate pain, but you gotta put an end to it. I was gaslighting myself throughout the whole month, thinking that pain is part of the recovery, and it definitely is. But I guess there is probably a very thin line or an unknown line between what's okay and what's not. And that's the key here for all of us to remember. If you are in pain, speak up. Yes, we don't want to be that person that's always annoyingly calling the doctor or the physical therapist complaining about the slightest pain. But if you have pain, let someone know and let them make the judgment. I think I should have done something earlier, but it is what it is. That's what happened, and now I learned my lesson, and hopefully you also learn your lesson. And yes, tolerate the pain, but there is just so much pain that you should be tolerating. The third one is that I feel like probably with any health issue, you gotta manage uncertainty. It's been very difficult to digest and interesting to understand what the path forward is. Because as of now, the way that we are seeing this is that if I have pain, then we'll address that pain. But if I don't have pain, then I move forward. So I don't have a timeline. I don't know. It's not that I have been told, okay, today you get the cortisone shot and in 6 months, if nothing has changed, you'll get the different medicine and in 6 months, you'll get the surgery. That is not how this goes. My understanding, and again, I'm not a medical professional, this is just my experience, is that every action will be or decision will be taken based on what I'm feeling. if I hurt in a month, maybe I'll have to get the other injection. And maybe I don't hurt in 9 months, and then maybe I have to get the injection, or maybe I am not going to hurt again. Hopefully. I don't know. And managing this uncertainty has been the most difficult thing that I've done. I am a type A person. I like to know what's going on. I like to have deadlines. I like to have an agenda. And recovery hasn't been like that. And I have to make peace with it. And I'm still fighting through it. Also, as an athlete, you want to plan ahead. You want to know when you're going to go back to your training. You have this championship that you want to go to. And I have nothing right now. I cannot plan. And I feel like even attempting to do it would crush me. So I'm just managing uncertainty and going with the flow, and I guess going one day at a time. And the last reflection that I have is that it's okay to feel bad. Going through these things can be really tough on our mental health, on our bodies. Being in pain for an extended period of time is no fun, and you will feel bad. It's normal for a human being to feel sad, upset, frustrated, angry, all these different negative emotions because you're going through something really, really hard. The only thing that I ask you to consider is that there is a fine line between feeling bad and self-sabotaging. And that's what I've been doing. I've had so many negative thoughts in my brain that I started feel like self-sabotaging. I linked somehow those negative feelings and emotions to my recovery, and I feel like that has added more challenges to the recovery. I feel like this negativity has made my pain worse, has made my willingness to move forward weaker. It has not helped. Again, it's totally normal to feel bad, but don't go to the extent in which you're harming yourself. I am learning, and I'm sure everybody has told you, and everybody has told me as well, that a lot of the recovery is in your head, and you need to be in a good headspace to move forward. So don't blame it on yourself. Don't feel bad about feeling bad. Feel your feelings and try to move forward, because that's the only way that we have. We can't stay stuck. We can't go back. We have to keep moving forward. And with this, I'm going to finish this video, and I'm going to finish month 5, which probably has been one of the darkest months in my life. We'll see what the future brings. And I certainly wish and hope that your recovery is going better than this. But if it's not, hang in there, because hopefully we'll see the sun after the darkness. Thank you for watching.